Hi, I'm Dr. S.S. Honnani, surgical gastroenterologist. Today I'm going to speak about carcinoma stomach. Carcinoma stomach is cancer of the stomach. What are the risk factors? See, most common cause of carcinoma cancer in present day is eating canned food, preserved food, pickled items, or even burnt items like a dry fish burnt or prolonged preservation, especially meat and fish which is preserved for a long time. Even meat pickles, fish pickles, these are all high risk factor for carcinoma cancer. Also, patient who has got a gastritis, H. pylori infection which has not been treated or poorly managed over a prolonged time can develop into a cancer. What are the clinical features? Carcinoma stomach usually asymptomatic, we won't come to know. Most of them will have vague abdominal discomfort and features of gastritis. When we have a patient with the features of gastritis which has been treated multiple times is not improving, then we should offer them an endoscopy. These are the people who may have carcinoma stomach. Carcinoma stomach which is symptomatic means it is very advanced. If they very rarely they present with mass on abdomen, if they present with mass per abdomen, that means they are actually having end stage disease. The advanced stages usually patient will present with recurrent vomiting, not able to eat. They present as if they eat for 1 or 2 days, then suddenly third day they vomit. Once again they start eating for 2 days, then they start vomiting, and the vomiting will be very bad smell. This happens usually due to gastric outlet obstruction when the tumor is blocking the distal part of the stomach. So whenever we suspect a carcinoma stomach, first investigation choice is to do a endoscopy. When we do endoscopy, we see the lesion in the stomach. Whenever the lesion is there or any ulcer is there, we do the biopsy and we send it for the test. Once carcinoma stomach is confirmed, next step is assessing the stage of the cancer. So there are many ways. First thing is we do a PET scan. With the PET scan we will come to know where exactly the tumor has spread. It is mainly involving the stomach or any distant metastasis is there. And second thing is we assess how is the patient condition. Okay, if a patient is not in obstruction or gastric outlet obstruction or there is no distant metastasis, then we plan for them is the proper comprehensive treatment. Treatment has a stepwise. First we have to give neoadjuvant chemotherapy, then surgery, followed by completion of chemotherapy. All carcinoma stomach, if there is no complication, we have to give chemotherapy before surgery. Once chemotherapy is given, then we do a laparoscopic or open gastrectomy. We now current standard is D2 or D3 gastrectomy. Both can be offered in laparoscopically. We do laparoscopic, robotic or open surgery. Like once surgery is done, means surgery can be distal gastrectomy or subtotal gastrectomy or total gastrectomy based on where the tumor is there. That the operating surgeon will decide. Once surgery is done, then we finish the chemotherapy. If a cancer stomach is diagnosed much earlier stage and treated properly with chemotherapy and surgery, most of them will have cure. But any cancer stomach which is above stage 2B will have reasonably less prognosis. In anything stage 3 or stage 4 have a short lifespan. Even if you offer a good surgery, it will give it kind of palliative. Stage 4 we cannot do any definitive surgery, only we can do is a palliative procedure. Post gastrectomy, most of these patients, because stomach is removed, they'll have something called dumping syndrome. That means when they eat semi-liquid food, suddenly they'll have abdominal pain, sweating, headache, these things can happen. So the post-gastrectomy patient should eat solid food and liquid food separately. They should avoid sweetened juices or ganji, these kind of stuff should not be eaten. They should eat solid food. Then if they want to drink something, they should drink half an hour before eating food or half an hour to 1 hour after eating food. They should avoid juices, any sugar juices they should avoid, because that sugar juices will cause increased incidence of dumping syndrome. Post gastrectomy, most of the patient will have anemia because iron absorption will be affected because there is no stomach, and they will also have deficiency of vitamin B12. So iron and B12 has to be supplemented regularly, and they should have regular follow-up. Initially we do it maybe once in 3 months, once in 4 months for 1 year. After that, once in a year we regularly follow up. Early stage cancer treated appropriately, almost they will have cure, but anything above 2B may not have good prognosis, but we can have a better quality of life with a proper treatment.